Coming to the next virus, which is very important for so many reasons, because uh, this is one virus which is which can cause a lot of different kind of manifestations or different forms of hepatitis. So when a person is infected by hepatitis B virus, the person might suffer from acute hepatitis or non-progressive chronic hepatitis. So it's a non-progressive chronic hepatitis is the chronicity will be there, but the aggressiveness will not be there. That next is progressive chronic disease. The person might go for a progressive chronic disease, which is nothing but cirrhosis, and the person might suffer from fulminant hepatitis with massive loss of hepatic parenchyma mass, massive liver necrosis, and it might just be asymptomatic carrier state. So these are some of the different types of manifestation with hepatitis B virus, and you must be knowing that hepatitis B virus in viral infection is a risk factor for hepatocellular carcinoma. So for all these reasons, hepatitis B virus becomes a very important virus which you should be knowing thoroughly. So when there is an infection by the hepatitis B virus, it can cause acute hepatitis, which might subside on its own. Around 70% of the individuals with hepatitis B viral infection, they have subclinical disease with no obvious clinical manifestation, and they don't manifest with any symptoms. So they just become asymptomatic, and they just get they won't even realize that they have had a hepatitis B infection. Then the remaining 30, they will have eccritic disease. So they will manifest in the form of yellowish discoloration of the sclera. So among the subclinical diseases, more than 90% recover. A very small fraction, that is less than 0.5%, go for fulminant hepatitis. So which is an aggressive form of hepatitis where the damage to the hepatic parenchyma is very quick, and manifestations or clinical features are very severe. So less than 5% of all the individuals with hepatitis B viral infections, they go for chronic hepatitis, that is long standing hepatitis. And what we have noticed is chronic disease rarely occurs in non-endemic areas. So there are certain areas where the prevalence of hepatitis B virus is pretty high. So in those areas only we are seeing conditions where are the only in those places where we are seeing chronic hepatitis with hepatitis B. Other than non-endemic areas, the chronicity is not noticed very frequently. So just remember, and once there is a chronic hepatitis, even among those individuals with chronic hepatitis, a lot of them will recover, and some of them, around 30% of the patients with chronic hepatitis, go for a healthy carrier state. That is, they don't have any manifestation, but they still harbor the virus. So then around 12 to 20% of the chronic hepatitis patients go for cirrhosis, and among the individuals who have gone for cirrhosis, a fraction of them might turn up with hepatocellular carcinoma. So this is how it is broken down, infection, how it manifests in different individuals, and some of them, a significant number of people infected with hepatitis B recover, that is as high as around 70%, whereas the rest of them will show other manifestations. So as I mentioned, a carrier state, I will be talking about it later. So just remember, carrier state depends on the age of infection. So if an individual is infected very early in life, the chances of that person becoming a carrier is pretty high. So depends on the age of infection and the commonest routes of transmission of hepatitis B. So it is parental route of transmission. So the commonest route is the parental route, and it is seen during childbirth, and entry of the virus can be through minor cuts and breaks, homosexual and heterosexual contacts, and IV drug abuse. So, it is commonly seen in IV drug abusers. So, the incubation period is a lengthy one, and as far as hepatitis B is concerned, it is around 4 to 26 weeks, and the clinical manifestations of hepatitis B is not any different from other viral forms of hepatitis. So, they usually present with anorexia, fever, jaundice, and upper right quadrant pain. So, as I mentioned, chronic diseases are rare in non-endemic areas. So, coming to the nature of the virus, or the type of the virus. So, it is a member of the Hepadna-viridae family. So, it has 8 genotypes, and there is something known as Dane particle. Dane particle is something that you should remember. It is nothing but a mature HBV virion. It is 42 nanometer in size, spherical and double layered. So, that is mature HBV virion, which measures 42 nanometer and is spherical in appearance and double layered, that is known as Dane particle. This one has a outer surface envelope which is made up of protein, carbohydrate and lipid. Coming to the genetic component or the core, that is made up of a genome which is partially double stranded circular DNA. So, this is something that you should remember, it is a partially double stranded circular DNA. So, the genome of the hepatitis B virus contains 4 open reading frames. So, remember it has 4 open reading frames for coding nucleocapsid core protein. So, it is a nucleocapsid core protein which is having an envelope of glycoproteins, which is again coded by an open reading frame in the genome. Then you have polymerase. The polymerase here it exhibits both DNA polymerase activity and reverse transcriptase activity. This is something you should remember. So, the polymerase in hepatitis B viral genome, it exhibits both polymerase, DNA polymerase activity as well as reverse transcriptase activity. Then you have something known as HBX protein, which is necessary for viral replication and acts as a transcriptional transactivator of the virus genes, of the viral genes. So, this is implicated in the pathogenesis of hepatocellular carcinoma. HBX, which is a component or which is a protein, is responsible or has been implicated in the causation of hepatocellular carcinoma in individuals who are infected by hepatitis B virus. So, how it progresses? So, the HBs AG, so the antigen starts appearing even before the onset of symptoms of hepatitis. So, first thing to appear is HBs AG or HBs antigen. So, this peaks during overt disease. So, when there is no clinical manifestation, it peaks and then gradually declines to undetectable levels in around 3 to 6 months. So, it becomes undetectable in around 3 to 6 months. So, next to rise is the anti-HBs antibody. So, once it will not rise until the acute disease is over. Once the acute disease is over, it starts rising. So, it is usually not detectable for a couple of weeks to several months after the disappearance of HBsAg. So, this will not rise till the acute disease is over. It starts increasing in titer gradually, and what has been noticed is this anti-HBs may persist for life. So, this is the basis of vaccination strategy against this virus. So, what this anti-HBs antibody, once it makes its appearance, it usually persists for life and protects the individual. This is the basis of vaccination against hepatitis B. So, you have something known as HBe antigen, HBV DNA and DNA polymerase. So, these are the components which start appearing in the serum after HBsAg. So, these three components, that is HBeAg, HBV-DNA and DNA polymerase, they are indicators for viral replication. So, when you see a high amount of these three components in serum, it means that there is a good amount of viral load and the virus is replicating. After this, you have something known as IgM anti-HBc. So, this becomes detected. This is detected shortly after the onset of symptoms. Once the person starts developing symptoms of hepatitis, so that is the time where IgM anti-HBc makes its appearance. So, but for the detection of IgG anti-HBc, so there is no direct assay, wherein you can detect IgM anti-HBc, but there is no direct assay for IgG anti-HBc. So, how you come to know the presence of IgG anti-HBc? That is by decline of IgM anti-HBc. So, there is a decline of anti-HBc IgM component, but there is a rise in level of the total anti-HBc. So, the anti-HBc total levels, if they are increasing, but at the same time there is a decline in the first antibody response, that is IgM. If it comes down and the total antibody levels start increasing, it means that the anti-HBc IgG component has made its appearance. So, that is how you know that IgG response is happening. So, and as I mentioned, HBeAg, that is a strong pointer. The levels of HBeAg and the presence of HBeAg is a strong indicator of the replication potential or the amount of viral load that is present in the individual, and chronicity. The possibility of the individual going for chronicity is pretty high if there is a high HBeAg level, and the person with high HBeAg level, they are highly infective. So, you should remember. But there are some strains of HBsAg there are some strains, so which undergo mutation in case of hepatitis B virus, which do not produce HBeAg. So, do not be fooled when there is decreased HBeAg, because there can be certain mutated strains where they do not produce HBeAg but are replication competent and still express HBcAg or HB core antigen. So, if there is HBeAg, if the levels are less, do not think that the viral load is less. It can be still, viral load can be still be high in cases of mutated strains. And there is something known as vaccine induced mutants. So, these vaccine induced mutants, they replicate in vaccine induced immunity. So, when a vaccine is administered for an individual, this vaccine can induce mutants, induce mutation in the viral genome, causing certain vaccine induced mutant which can replicate rapidly. So, you should know the possibility, because these two possibilities are something that you should be aware of, that is mutated strains which do not produce HBeAg but still can have a very high viral load, and vaccine induced mutants. These are two entities that you should be careful about, and these can be detected by PCR analysis. So, even these mutated strains and the vaccine induced escaped variants, they also can be detected by PCR analysis. So, the most important factor which determines the amount of injury that the person has to encounter or to suffer or will suffer depends on the host immune response. That becomes the most important determinant, and the response to this virus is by specific CD4 and CD8 plus cells. And this hepatitis B can be prevented by vaccination. As I said, the anti-HBs antibody, once it makes its appearance, it usually persists for life. That is the whole idea of giving a vaccine in this condition. So, the antibody response is it has been observed that it is a very good response, and it is seen in around 95% of individuals who are vaccinated. So, when you give a vaccine, there is a good antibody response, and once these antibodies are formed in the blood or in the body, they remain for a really long time and they confer the immunity. So, and this vaccine is produced or made from is from a purified HBsAg or purified HBs antigen, which is produced in yeast. So, as I said, so the incubation period, this is the diagram showing how the serum markers change. So, as I said, the first thing to arises, there is something known as serum transaminases. So, when there is an inflammation of the liver tissue, this serum transaminase they start increasing, and the subsequent markers like serum markers like HPEAG, HPUDNA, and HPSAG, they start making their appearance at the respective time frame. So, the first one is the HPSAG, and then you have anti-HBs antibody, then you have this HPEAG and HPVDNA, which are markers for infectivity, replication, and chronicity. So, they are these things and mainly viral load, most importantly the viral load and the replication potential and the infective nature of the individual can be assessed by these three components. So, once there is once the acute phase passes, the first response is by the IgM component. Over a period of time they switch over to IgG. So, the initial response is by the IgM antibodies of different classes. Again, this is the same showing serum markers for how they are elevated and how over a period of time some of them disappear and some of them persist. Coming to the next entity, that is hepatitis C virus. So, it is one of the most common blood-borne infection. So, why this hepatitis C becomes important is because the progression to chronicity in hepatitis C is of a very high percentage. So, around 20 to 30% of individuals with hepatitis C virus can go for cirrhosis. So, that makes this virus much more dangerous, and the viral load that is required for this virus to infect a person is significantly lower in comparison to other viruses. So, the commonest risk factors are IV drug use, and the other mode of transmission is the sexual transmission. Other risk factors being surgeries within the last 6 months. So, if an individual has had a surgery within previous 6 months, he is basically exposed. So, that is another risk factor. Needle stick injury and contact with HCV infected individuals. So, that also becomes a major risk factor. And as of occupational risk, it can be said that individuals in medical and dental field disciplines, they are much more at risk in comparison to the general population. So, it is so infective that risk of needle stick injury which causing HCV is around 6 times more than the HIV. So, and it has been noticed in mainly in children, the transmission is mainly perinatal. So, during the perinatal period, the transmission of this virus is much more common. So, coming to the classification, it belongs to the Flaviviridae group of viruses, and it is a single stranded RNA virus, and the nature of this virus is such that it is even though there is an immune response, the immune response doesn't confer any form of immunity in this condition, because there are a lot of structural alterations in hepatitis C genome which will give rise to a lot of mutant subtypes or different subtypes, and that makes it very difficult for the body to mount an immune response to this particular virus. So it has a the genome is such that it is has a 5 dash n 5 dash n of the genome, which codes for nucleocapsid, that is 1n, and it has envelope proteins which is E1 and E2, which is coded by E1 and E2, and there is a component known as P7 which acts like a ion channel. There is a 5 dash n and the 3 dash n. So towards the other end, or the opposite end of that 5 dash n, you have a lot of non-structural proteins which are 6 in number. So in these non-structural proteins, they are 6 in number. Among these non-structural proteins, there is something known as NS5B, which is a RNA dependent RNA polymerase which has poor fidelity. So this component, this RNA dependent RNA polymerase, which is located in NS5B, is responsible for a generation of lot of quasi species or different variants of the hepatitis C which are divergent from the main virus, but they are very closely related. So this NS5B component makes the NS5B component of the genome makes it highly unstable, giving rise to a lot of quasi species which are genetically slightly divergent, but nonetheless it is related to the main HCV virus. So this is the viral genome. So it has two ends which codes for the core protein, the envelope proteins, an ion channel, a protease, and the a lot of non-structural proteins. And among those non-structural proteins, the NS5B, or that is RNA dependent RNA polymerase, that makes it highly unstable, leading on to a lot of generation of a lot of related subspecies. So it becomes very difficult for the body to mount a immune response. So I said, because of the presence of various different related but divergent strains, the antibodies cannot confer an effective immunity. So the hallmark of hepatitis C virus infection is repeated bouts of hepatic damage. So any viral response, it will elicit a T cell. Cell mediated immunity will be the one thing which will mount a response. So there is a strong immune response with T cells, but even though there is a strong immune response with the T cells, because of generation of these subspecies, these antibodies will not be, or the immune responses will not be helpful. So what has been noticed is a good number of patients go for cirrhosis, which can develop in around 5 to 20 years. So it's a long time frame, but still 5 years to 20 years in a hepatitis C virus infected patient, the chance of that person going for cirrhosis is pretty high. So what it does is it interferes with the interferon response. This interferon response, it is required for mounting an effective defense, or it's a defense mechanism for viral infections, but HCV makes sure that it interferes with the interferon response, thereby preventing any damage to its genome or any damage to itself. So what it does is it affects viral recognition. So it will alter itself in such a manner that it will affect the viral recognition, and there is the downstream interferon response is totally hampered. So what it does is it is able to actively inhibit the interferon mediated cellular antiviral response. So interferon is responsible for generation of a lot of cellular antiviral response, but it interferes with that mechanism. So it can do it in a by a lot of ways, like by by its interaction with toll-like receptor signaling, and once this toll-like receptor signaling response is altered, the viral RNA recognition and signaling downstream, the downstream signaling of interferon receptors that confer an antiviral state is severely compromised. So, it will affect the interferon response. So, for how do you know, how do you assess the replication? So, you do a HCV RNA load assay. So, when you do a HCV RNA viral load, that will give a clear picture of the replication, how rapidly it is replicating in the individual. So, as I said, there is episodic or bouts of hepatic damage, so which is reflected by episodic elevation of the aminotransferases. So, there is an intervening near normal period. So, even though the person is having hepatitis C virus in his body, he might be absolutely normal, because one of the hallmark of this hepatitis C viral infection is episodic elevation of aminotransferase or bouts of hepatic damage, periods of hepatic damage with intervening normal periods. So, again this is the figure showing how the markers, that is a serum marker for hepatitis C viral infection is HCV RNA. These transaminases, remember, these are elevated in hepatic damage irrespective of which virus is causing it. So, transaminases are usually elevated in all forms of insult to the hepatic parenchyma. So, this is a representation of the same. So, coming to the next entity, that is hepatitis D virus. Hepatitis D virus. Hepatitis D virus, that is the next virus that we have to know. It is a RNA virus. So, it is a RNA virus, and the peculiarity of this virus is it is an RNA virus that is dependent on HBV for its life cycle. So, the infection with HDV can occur in two settings, that is an acute co-infection where there is infection by both hepatitis B and hepatitis D simultaneously. So, that is acute co-infection or super infection, where when a chronic carrier of HBV is exposed to a new inoculum of HDV. So, the person is already infected by HBV, there is superimposed HDV, that is super infection. So, then the other form is the helper dependent latent infection. So, it is commonly seen in liver transplant settings. So, here there is infection of the allograft by hepatitis D virus alone. So, just remember, hepatitis D virus is a virus which requires the presence of hepatitis B virus for it to be effective, or for it to manifest with a response. So, and the marker that we use to detect hepatitis D virus is IgM anti-HDV, and which is a marker for acute infection. Just remember, without HBV, there is not much role for this hepatitis D virus, because it requires the presence of hepatitis B virus. So, and the treatment for this is interferon alpha. So, I mentioned this because, as we have seen in hepatitis C, the hepatitis C is a smart virus. So, it will manifest, or it will prevent an effective mounting of an interferon response, thereby making sure that it is chronic in nature by persisting in the body, by altering its genomic structure and creating a lot of quasi species. Next one is hepatitis E virus. So, hepatitis E virus, it is a enterically transmitted waterborne virus. So, it is commonly seen in young to middle aged adults, and it has been noticed that it is a zoonotic disease with an animal reservoir, and it belongs to a Hepavirus genus, or they also say it as a calicivirus. So just remember, it's an enterically transmitted virus commonly seen in young to middle-aged, waterborne. It has an animal reservoir also. So not, and it is not associated with any form of chronic liver damage. But one thing that you should remember is it has a high mortality rate in pregnant women. So if a pregnant woman is infected by hepatitis E virus, the mortality rate is pretty high. Around 1/4 of the pregnant women who get infected by hepatitis E virus, they have grave prognosis. And for in other individuals, they just it gets resolved within 2 to 4 weeks. So high mortality is in pregnant women is something that you should remember as far as this virus is concerned. Then you have something known as hepatitis G virus. It is very similar to HCV, that is what has been described, and it is transmitted by contaminated blood and blood products. So it is the route of transmission is transmission by contaminated blood and blood products, and there is a sexual transmission also for this hepatitis G virus. But it is said that it is non-hepatotropic because the virus replicates in bone marrow and spleen. So unlike other hepatotropic viruses, here basically this virus replicates in bone marrow and spleen, and because this replicates predominantly in bone marrow and spleen, the elevations in serum aminotransferases are not noticed as far as hepatitis G virus is concerned. And another factor that you should remember is it is commonly seen in association with HIV. So hepatitis G virus is commonly seen in association with HIV. So this is the summary of the hepatotropic viruses. So you make sure that you go through this chart, because this has encompassed everything that you need to know as far as hepatotropic viruses are concerned. So because clinical manifestations are indistinguishable, they are similar to different forms of hepatitis or hepatitis caused by different forms of hepatotropic viruses. So this is a chart, or this is a table that you should be aware of. So it has a classification of virus, whether it's DNA or RNA virus. You can see hepatitis B is the only DNA virus here. Then you have routes of transmission. So and then incubation period. You can see hepatitis B has maximum incubation period. Chronicity. So chronicity, where you will get chronicity. So the chronicity is in hepatitis B and C, and the remaining things that you should be aware of. So this is one table that you should try to remember.